Welcome back to the show, viewers. This is Sahara TV. We're bringing you a special Inspire segment this week with Dr. Imoh Okon, a cancer scientist at the University of Oklahoma Health Sciences at Oklahoma University. He has recently written a book titled Winning the Fight Against Cancer, a Layman's Guide, where he attempts to explain cancer for the general public. And he provides research and brings it from the difficult medical terms into terms that can be understood by the general populace, so they have more information on cancer and other chronic illnesses, so that there's a more informed public out there for the families, for the patients, and just for the healthcare industry at large. He is speaking to us today about the rising cancer rates, particularly in Nigeria, and we'll make some comments about chronic illness in Africa. So just a couple statistics. In a report published in July 2011, it was found that cancer rates are expected to grow 400% over the next 50 years. Also, in developing countries have provided funds in the past, and there's big drives for infectious diseases like malaria, HIV, AIDS, and other related infectious diseases, tuberculosis, while there's very little development so far that has gone to things like cancer treatment, and it's going to be very curious to when and if and how the shift will come to have a more balanced focus on infectious diseases as well as chronic illness. So thank you so much, Dr. Okon, for joining us today. Welcome to Sahara TV.
Thank you for having me.
So I think we're going to start out, before we dive into the great research that you did with the book, if you could tell us, what do you think the rise of cancer is being caused by? Are there any specifics to it? Is it just something as society has grown?
So, by the very nature of cancer, it's a very and highly individualistic disease. And so there are multiple factors on different levels. So an aspect of cancer would come from genes, which is being predetermined based on the genes inherited from parents. And then we think the rising rates of cancer can also be attributed to today's lifestyle. We're having a lot of sedentary activities, more time on TVs, more time on games and computers. We're having drive-through prescription, drive-through banking services. There's actually less physical activities. And we're also seeing a frequency in really, really unhealthy diets, fast foods and, fatty diets with salt and all of that. So we think all those different aspects, including environmental impact, pollution, is actually playing different roles to a different extent to actually drive the increase in the cancer rates we're seeing.
Okay, yeah, that's very interesting. I mean, a lot of societies tend to switch to a more, not necessarily easy lifestyle, but a different type of lifestyle where you're talking about where there's less physical activity. I mean, we've definitely seen it here in the developed world in the US and in Europe, and my understanding is it's taking over in different parts of Africa as well, as people, it's kind of ironic, as society becomes better, these things show up because they actually have more power to do these things like you're talking about. Now we have like drive-in banking where perhaps we didn't, you had to walk to the bank. So it's funny how like certain improvements in society lead to other risks as far as things like chronic illness. So we've seen an international push in the international community and across Africa to fund research for HIV, AIDS, the pandemic, as well as there's a global fund for malaria and tuberculosis and different diseases. And we've seen a lot of funding on infectious diseases in general. Do you think, and how would it go about if there is a shift in chronic illness research, as well as funding to provide both the research for the continent and Nigeria, and as well as how about the health industry, for example, in Nigeria, would be able to make the transition?
Right. So the successes we've seen here in the US and in Europe has stemmed from years of networking and systemic connection at different levels. So you'd need a political willpower. You'd also require the health policymakers. You'd also require a lot of interplay between the different hospitals and medical facilities, connecting that with academic research. Because we know from experience that you actually need to be able to understand what is pushing this increases. And with cases like the HIV/AIDS, we've seen public media involvement that has helped to bring about awareness. But we think with cancer, it's a silent killer. And people out there still don't know just how much cancer and the impact of cancer is affecting families. And this is true for other non-communicable diseases like cardiovascular diseases. And so we think there has to be a public awareness across board, from the political angle of things to just the general public, where we need to connect these changing health patterns and think of a systemic way to approach and actually implement them to see real results. And like you know, most of these diseases are not short-term, one-fix solutions. They require long-term strategic monitoring. So there needs to be a well-articulated, documented way of going about this strategy to really make sure we can move patients from start and throughout the cycle of this disease and make sure we can account for the eventual outcome. And also, really, prevention would be key. How do we prevent this disease? That would be key. So preventive programs would be also important here.
Okay, great. So the Nigerian healthcare industry, for example, is not in a good state. In fact, many would argue that perhaps it's in shambles, where people, can't get basic healthcare that they need. And in fact, you see political leaders at times going abroad to get more advanced health, even for things that are not necessarily aren't that advanced that they would need healthcare for, that a country like Nigeria should be able to provide. For something as advanced as far as diagnosis and treatment and long-term care, really, for cancer and other non-communicable diseases like diabetes, did your research show, was there any network in Nigeria that's currently running to help treat the disease, or at least diagnose the cancers and other non-communicable diseases that people have? I mean, have you seen any improvement over the time, maybe at the beginning of your research to the end?
Right. So they have very few organizations actually working on cancer. There is one here based in Wisconsin called Courage to Dare. So it's actually from a lady herself who's a stage 3 breast cancer survivor. And so she came up based on her experience and as a survivor to start this cancer initiative. And she's gone back a few times a year with a few experts from here to provide just basic awareness programs. And I know they've also tried to embark on basic screening programs because, like I mentioned earlier on, I think prevention would be key. And for something like cancer, if you can improve the screening programs where people can have access to screening twice a year, and then people who have a family history would require much more frequent screening. And people that have certain at-risk jobs, like those exposed to oil emissions and gas emissions, gas flare, they would also require much more stringent screening programs. But we found that this whole knowledge, especially as it relates to Nigeria, was just not there. And so we think there has to be this culmination of efforts from different angles to try to improve awareness to begin with prevention, and then try to increase the screening programs to prevent the cancer. And then with people who already have the disease, we need to understand what grade and stage. And this requires real specialists in the field, like oncologists, because cancer is a very individualistic disease. And so you'd hardly ever find two same people with exactly the same cancer type. So you actually need to understand for every particular patient what the causes are and what the potential outcome would be, and design a specific precision-based therapy for each patient. And so I think it would begin with basic prevention and then information and then provision of access to health services.
Yeah, because I mean, every time you can start with prevention, of course, you can mitigate the costs and time and really the potential suffering that people go through doing those long-term treatments, specifically for diseases like cancer.
And it's also less expensive.
Right, of course, yeah. So your book titled Winning the Fight Against Cancer, A Layman's Guide. Please, can you tell us a bit about the research that you did for this and then what your goal is for people, when they take this book, what do you hope that they get out of it?
Thank you. So this book stemmed from years of my personal research with cancer. Just speaking with the general public, they didn't have, or there was no basic information as to what cancer was. And they'd say, what is cancer? Beyond just hearing the name cancer on the telly or, family friend or, member at church. So this book actually came about trying to communicate effectively what we knew in the research environment. And so you'd go for, scientific conferences and you'd be exposed to advances, in understanding of cancer and the potential new drugs and therapies for cancer. But it turns out most of the studies would end up within academia and in scientific journals. But you'd have very, very, if at all any, member of the public who reads any of the scientific journals. And so the work we had in the research environment all would end up in a scientific paper and never make its way to the public. And so even though we had a massive astronomical rise in knowledge with respect to cancer and how we can cure this disease, the public was still in the dark. And so, in essence, this book was actually trying to bridge that gap, to connect what we know about cancer, beginning from prevention, and also sharing real life experiences of cancer survivors, and even those that lost their loved ones to cancer, what their own personal experience were from the initial onset, the initial diagnosis, the response to treatment, all those days of throwing up and losing weight, and all the side effects of cancer treatment, losing the hair. How did they take it? And how did they find the finances to deal with this disease? And so we came from a very real life, personal encounters with people. And we also spoke with the clinicians, the doctors, the cancer nurses, the family members, first-hand experience accounts. And then we came back to what we knew based on scientific research. And we tried to put all this information together in one book. And then we tried to lay this out in real, simple, but factual accounts so that the general public out there could have a true sense as to what cancer really was and as to how, you could deal with it and, in essence, how you can prevent it. But in essence, if you actually had the disease, you could actually become more informed and understand, all these treatment options and how to better cope with the disease.
Okay, you mentioned about prevention. You talked about it before. What are some of these steps that people can take to really prevent or at least make themselves less likely to get some of these non-communicable diseases?
So, a lot of people think, especially people without a family history. And when I say family history here, I mean people whose family members have no history of cancer, not on the mom's side, not any auntie, not any uncle, not on the dad's side. And so because they don't have any family history of cancer, they think they can never have this disease. But from scientific research, we found that what is being known as sporadic cancers due to mutations that can occur from environmental impact, this can actually result in people without a family history having this disease. And so, in essence, this book is actually trying to bridge this gap and let people know that you can really minimize the risk of having cancer by real simple lifestyle choices, starting with things like trying to minimize exposure to environmental things, just from air fumes, toxic air exposures, the chemicals you're exposed to, even certain foods we eat that have all these preservatives. These are all chemicals. So people today depend more on preserved and processed food as opposed to what we had years back, freshly made food, So people go these days for easy to make fast food chains.
Right.
And I'm not saying it's all bad, but we actually need to minimize the intake of unhealthy foods, because this all have an impact in the long run on how the cells can accommodate and respond to these toxic influences. And then we also have lifestyle choices. So today, people, like I said before, is more or less things that get done with just the push of the button.
Right.
You don't have to, do any frequent work or, exercise. People sit back on computers, on tellies, sedentary lifestyle choices. And then we've seen an obese population. And scientific studies actually show a correlation between obesity and cancer. In
Wow.
fact, about a third of cancers are being attributed to obesity. And so we're actually seeing that lifestyle choices is actually impacting on the cancer incidence.
Right.
And so what can we do from a very basic level, to prevent cancer? Prevention is still key here.
Yeah. Well, thank you for that. I think we're about to wrap up with one final question here for you, Dr. Okon. With the rise of chronic and non-communicable diseases in Africa, what is the time frame that you see for, really necessary for governments and people to take notice on the continent and in Nigeria before the rates become almost too high to deal with? What is the time frame based on what you've seen in your research on the rising rates now and the rates speculated to go forward, is exactly the time frame that either the rates will become very difficult to deal with? Also, what is the time frame that it takes to bring an operational system online, for example, or how to transition healthcare to properly deal with some of these things? Is there a specific time frame to this?
Right. We think really it's a race against time. I think everything needs to be done, everything possible to try to really have a systemic plan in place, because we know, I'd expect, with the rise of communication across the continent, we could tap into access, just basic provision of access. So people now have mobile phones, people now have access to internet services, people don't have access, to cable networks. So this sort of thing would help in providing awareness programs. It would also help to create a real strategic game plan in terms of making sure we can account for people coming up with these disease types. And we can actually, have a way of tracing the outcome. So we think there has to be a neat and real clear-cut strategy. I wouldn't say it's all down to political will. I'd say the wider public as well needs to have a hand in all of this. We think there has to be a synergy from the political class to the general public, where what can we all do as a people and as a nation and as a continent? What can we do to provide information? What can we do to prevent these non-communicable diseases? What can we all do on the personal level? What can we all do to provide access to accurate information that would help prevent these diseases? So we think it's a race against time, because we see either there's a complete lack of knowledge or there is a complete lack of willpower to try to really move these health conditions forward. And so we actually need to bridge that gap on every front possible.
Okay. Well, viewers, that was Dr. Imoh Okon speaking with us today, a cancer researcher at the University of Oklahoma's Health Sciences in Oklahoma, and he's recently written a book called Winning the Fight Against Cancer, A Layman's Guide. Thank you so much, Dr. Okon, for being with us here today on Sahara TV.
Thank you, my pleasure.
Well, that is it for this segment, viewers. We now have Skype calls coming up, so please join us on SaharaTV on Skype. We'll be taking your calls on both this issue that we had in our earlier segments as we look back at 2012 and the stories that we covered and that came across the continent.